In the previous DSM, in the DSM-4, there was a bereavement exception, which meant that if you lost someone, a significant other, you could get the bereavement diagnosis for 2 months before it turned to major depressive disorder. Most of what we know from research on bereavement comes from loss of a spouse, but that's only one type of loss. There's loss of a child where the depression rate is probably 99 to 100%. There's loss of older parents, there's loss of parents when you're a child, and the model of losing a partner doesn't equally fit all of those, and that's one of the difficulties. So they actually have done away with the bereavement exception. You can now give a diagnosis of major depressive disorder immediately after a loss. And the thought is that some people have what is really a treatable disorder, and that it should get early intervention and not wait until you've seen it for several weeks, and that there is a difference qualitatively between grief and depression. And I could go on about that, but I'm not going to now. I get to say that they have nixed the mixed anxiety depression disorder. There's a lot of talk about that with each new DSM, because as you know, there's a lot of overlap of symptoms between anxiety and depression, difficulty making decisions, difficulty concentrating, etc. And so mixed anxiety and depression is actually one of the more frequent clinical presentations. And so there's always been talk about whether there should be such a diagnosis, and if so, should it be with the anxiety disorders or should it be with the depressive disorders? In DSM-4, it's an example of using anxiety disorder NOS. In other words, if you saw mixed anxiety depression where neither one predominated, you would give anxiety disorder NOS. That's not true in DSM-5. They didn't put it in, but if you have both, you give both diagnoses. However, it probably is going to be in the third section requiring more research.